I'm going to be your nurse today. We'll go ahead and start off with what's your first and last name?
Chris Joe.
Thank you. And then can I have your date of birth, please?
5/16/92.
All right, that information matches your tag on your wrist. Okay, so I'm just going to start off with a couple of questions and then I'll direct you through everything. Okay. So what brings you in today?
I have a migraine.
A migraine.
Yes.
Oh, okay. And then, so I'm just gonna go ahead and assess your pain. So is that pain coming from like the back of your head, or where is it coming from?
It's like right here.
Oh, okay. So it's coming from the front. Okay. And then do you wear glasses?
No.
When's the last time you've been to the eye doctor?
Some years. I don't need glasses, from what I know.
Okay. Okay. And then, what is there anything that makes the pain better?
Laying down.
Okay. Okay. Is there anything that makes it worse?
Light and loud noise.
Okay. Okay. And then, go ahead and describe like the quality of your pain.
A 7 out of 10.
Okay, so your pain level is a 7 out of 10. But when I say quality, like, what does it feel like?
Like a loud speaker going off in my head.
Okay, okay. And then, does the pain radiate? So I know you said, if you don't mind, I'm just gonna go ahead and feel your forehead. You said the pain's kind of right here. Does it radiate anywhere?
It just stays there.
Okay. And then, when do you usually have the pain? Is it usually in the morning, at night? When do you usually notice it?
Around nighttime.
Around the nighttime? Okay.
Yes.
And then, okay. And then last question is, does the pain affect like your daily activities, like you going to work or just getting up in the morning, brushing your teeth? Does it affect those daily activities?
Nah.
Okay. Okay. Patient's ethnicity, he's African American. He seems to be in shape. He's calm and cooperative. Seems well nourished. Seems pretty taken together. I don't see any lesions. No scarring. Patient's hygiene seems to be well kept. He doesn't really have any physical deformities. He's only complaining of the head pain, and he seems to be safe. He's wearing slides, but it's okay. So he seems to be following all the safety measures. I'm gonna go ahead. Vital signs have already been done. I completed the blood pressure on patient's right arm. Blood pressure was 120/80. He had a respiration rate of 18, a heart rate of 87, and again his pain was a 7 out of 10 as noted. Patient's oxygen saturation rate was 100%. And then now I'm gonna go ahead and start with his full head to thorax assessment. So Christopher, I'm just gonna go ahead and I'll let you know where I'll be touching, but I'm just gonna go ahead and walk you through this assessment with me, okay?
Okay.
All right, so I'm just gonna go ahead and inspect the head. There doesn't seem to be any facial drooping, no lesions, no redness, no physical, nothing seems to be going on with the head. As far as the skull seems to be symmetrical. No lesions to the skull. It doesn't seem to have any trauma that has been done. I'm gonna go ahead and assess your hair if you don't mind me touching. All right, am I okay touching?
You're fine.
Okay, so I don't see any alopecia, no redness, no infestations. Okay, so as I go ahead and move down, I'm gonna have you sit your head up, please. I'm gonna go ahead and palpate your sinuses, okay? So just let me know if you feel any pressure or any pain, okay? I'm gonna go ahead and palpate the frontal sinus and then the maxillary sinus. Any pain? Okay, no tenderness. Okay, so then now I'm gonna go ahead and assess your eyes. I'm sorry, you just gotta keep your head up. So I'm gonna go ahead and assess your eyes. Patient's eyes seem to be symmetrical, aligned with eyebrows. I don't see any lesions, no scarring around the eyes. I'm gonna go ahead and pull down on your lower eyelids. I'm just gonna go ahead and look at the conjunctiva, okay?
Okay.
Alright. So patient's conjunctiva is pink and moist, white sclera, no lesions noted. Okay, and now I'm gonna go ahead and look at your ears, okay? I'm gonna go and look at each side. As I touch the pinnae and the tragus and the mass, as I go ahead and touch your ears, let me know if you feel any pain or tenderness. No pain, no tenderness?
No.
Okay, patient's ears seem to be in good condition. I don't see any redness, no scarring, no lesions. I'm gonna go ahead and go down to your nostrils. So Christopher, what I'm gonna have you do is hold one of your nostrils. You can start with the left or the right, it's up to you. And then just go ahead and breathe out. I'm gonna check to make sure your airway is clear. Go ahead and hold and then breathe out. All right, and then do the same thing with the opposite side. All right, patient's airways nostrils are clear and patent. There's no sign of obstruction. So I'm gonna go ahead and get my pen light and I'm gonna go ahead and look at your mouth, okay? I am gonna have you say ah, and then I'm just gonna look on the sides and in the back just to make sure everything's good, okay? All right, first I'll start with the outside. I don't see any lesions, no scarring, I'm sorry. Go ahead and say ah for me, please. All right, go ahead and stick out your tongue. Thank you. So patient's mouth seems to be in good condition. I don't see any redness or anything, no lesions. Patient's tongue is pink and rough, and the dental seems to be well kept. And all right, so now I'm gonna go ahead and inspect your neck, okay? So if I could just have you lift your head up for me, please. I'm gonna have you sit back. All right. So I don't see any, patient's neck seems to be symmetrical. I don't see any redness, no lesions. All right, and then now I'm gonna go ahead and palpate your trachea. Trachea is midline. It's midline. There's no deviations. You don't feel any tenderness or pain, correct?
Mm-hmm.
All right. Now I'm gonna go ahead and just palpate your lymph nodes while I'm there. Okay. I'm looking for any masses or if patient has any pain. So I'll start with the I started with the submental and then submandibular. I'm gonna go ahead and check your tonsils. I don't feel any inflammation. Now I'm gonna go ahead and go down to your supraclavicular. Go ahead and go under. All right, I don't feel any masses, no inflammation going on. Now I'm gonna go ahead and assess your range of motion, Christopher. So if you can go ahead and put your ear to each side of your shoulder. So we'll start off with your right, and then your left, and then go ahead and put your head back, and then down to your chest, and then you can put your head up straight now. All right, so did you feel any pain when you were doing that, any stiffness?
No.
All right, so patient has full range of motion with no pain or tenderness or stiffness noted. I am now going to go ahead and move down to the cranial nerves. So we'll go ahead, same thing, I'll walk you through it, and I'm just going to assess some of your cranial nerves, okay? All right, so we're gonna go ahead and start with the olfactory nerve. So I'm gonna have you close your eyes and just tell me what scent you smell, okay? I'm gonna go ahead and put something under your nose where you can smell, okay? So just go ahead and close your eyes. Tell me what you smell, please. Now I'm going to go ahead and assess cranial nerve 2, the optic nerve. Snellen chart was completed with vital signs earlier. Patient seems to have a 20/20 vision, does not wear any glasses. I'm going to go ahead and do one more assessment. If I can have you go ahead and cover your right eye. And then I'm going to put my hand out. Just tell me when you see my hand. Just look straight forward at me and then tell me when you see my hand, okay?
I see your hand the whole way.
All right, and then I'm gonna go ahead and do it one more time. Go ahead and cover the opposite eye, please.
I see your arm and hand.
Perfect. Okay, so confrontation test is good. Patient saw a hand when I saw exactly when I saw my hand. So cranial nerve 2 is intact. I'm now gonna go ahead and assess cranial nerve 3, 4, and 6. So patient's eyes, as noted before, I'm gonna get my pen light. Patient's pupils seem to be equal, round, reactive to light, and accommodating. And now Christopher, I'm just gonna go ahead and turn off my light. I'm gonna go ahead and just follow my my pen, okay? Alright, going ahead and did the 6 cardinals. So cranial nerve 3, 4, and 6 are intact. I'm now going to go ahead and have you clench your teeth. And then if you don't mind, I'm going to go ahead and palpate your face, okay? Go ahead and clench. You don't have to smile. You can just clench down. Okay, go ahead and clench one more time. Go ahead and clench one more time. Okay. Go ahead and clench. Okay, there it goes. Okay, so just making sure that I was cranial nerve. Sorry, I'm gonna go ahead and close your eyes. I'm gonna go ahead and just I'm sorry. Let's see your hand. So this is what's gonna feel like when I touch your face. It's very soft, but I just want to make sure your face you're able to feel the touch I feel, the soft touch on your facial expression on your face. Okay. So go ahead and close your eyes, please. And then just let me know when you feel me poking your face.
I feel it. I feel it. I feel it. I feel it.
All right, perfect. So cranial nerve 5 is intact. I'm now going to go ahead and assess cranial nerve 7. Can you go ahead and smile for me, Chris? All right, can you frown for me? Go ahead and frown. All right, and then go ahead and puff out your cheeks. All right, and then go ahead and squeeze your eyes really tight. All right, facial nerve cranial 7 is intact. I'm now gonna go ahead and have you say "ah," Christopher. Go ahead and say "ah." All right, so I saw the soft palate rise. Now go ahead and stick out your tongue, and then can you move it side to side, up and down? Perfect. So cranial nerve, glossopharyngeal hypoglossal nerve are intact. That's cranial nerve 9 and 12. Sorry. And then cranial nerve 11 is accessory nerve. So I'm gonna have you go ahead and shrug your shoulders up and then down. All right. Now go ahead and do it against the resistance of my hand. Go ahead and shrug your shoulders up and down. All right, cranial nerve 11 is intact. I'm gonna go ahead and do cranial nerve 10. I kind of already said that as I was going through this. Patient didn't have any hoarseness when he was talking. Can you go ahead and swallow for me, please? All right, and patient is able to swallow, so I'm gonna go ahead and note cranial nerve number 10 intact. Christopher, now I am gonna go ahead and assess your chest and each part of your heart, and I'm gonna go ahead and listen to it with my stethoscope if you don't mind. It is easier if you expose your chest so that I have better access. Do you mind lifting up your shirt? That way I can see at least your upper chest, and then I'm gonna have to go like right here. If it's easier, you could just lift up your shirt. Okay, yeah, that's fine. Thank you. So as I'm assessing, you can just go ahead and relax your arms. I'll hold it up for you. So just go ahead and breathe in and breathe out as I move my my stethoscope, okay?
Okay.
Alright, so I'm gonna go ahead and start off with the aortic. Go ahead and breathe in and breathe out. I'm now gonna move to the pulmonic. You don't need to breathe in. It's okay, I'm just gonna go ahead and listen. I'm now gonna go ahead and move down to Erb's point. And now the tricuspid. And now I'm going to move down to the maxillary, which is mid-clavicular at the 5th intercostal space. I'm going to stay here a little bit longer because I am going to stay here about a minute so I can take the patient's pulse as well. Alright, so patient's heart rate is 87. I'm sorry, Chris. If you could leave your shirt right there, I'm going to go ahead and do the same thing, but with the other side, with the bell side of the stethoscope. This one, I'm listening to see, make sure I don't hear any heart murmurs. But when I was at that, when I was at the mitral site, which is also known as the point of maximal impulse, patient's heart rate was 87, so it matches the pulse taken earlier, the radial pulse taken earlier. Christopher, I'm going to go ahead and do the same thing again.
All right.
I'm going to start at the aortic. Pulmonic. Herbs. Tricuspid. And then the mitral. Alright, so as I was looking at the patient's chest, you can go ahead and put your, I am going to go back and do the respiratory, but you can relax with your shirt down now. As I was looking at the, doing the cardiovascular, I was assessing the patient's skin, and I didn't notice any redness, any lesions, like anything like that. I am going to go ahead and do, now go ahead and listen to his lungs. This, I'm going to make sure I go very slowly so that I'm listening to each part of the lungs with every breath. So again, Christopher, this one, before I was listening to your heart, now I'm going to go ahead and listen to your lungs, and I'm just making sure I hear clear lungs, and making sure I don't hear any abnormalities, no crackling, nothing like that, okay? So give me one moment. I'm going to have you do the same thing. If you can go ahead and lift back up your shirt. And then this one you are gonna take a deep breath in and a deep breath out with every time I move the stethoscope. Okay.
Okay.
This one, so if you can pull it up a little bit higher. Okay. All right, so if I can have you go ahead and turn around for me, I'm now gonna go ahead and listen to the back of your lungs, okay? If you don't mind taking off your shirt, this one is gonna go up a little bit higher. I'm sorry. And then if you're comfortable, you can turn around a little bit more. All right. Alright, so I'm now going to go ahead and listen to his lungs posteriorly. I'm also looking at the patient's back, seeing if I see any scarring, any lesions. Patient's spine, I'm going to go ahead and palpate patient's spine. I don't feel any inflammation. Patient's spine is midline. If you can go ahead and breathe out for me, breathe in and breathe out. All right, so the chest, patient's chest rise was symmetrical and everything. His AP is 1 to 2. So now I'm gonna go ahead and listen to his lungs. Again, Christopher, if you can go ahead and breathe in and then out for me, please.
Sit down. Sit down.
Go ahead and sit up for me. Breathe in. Okay. One more time. One more time. All right. I didn't hear any abnormalities. Patient's breathing was clear. Okay, Christopher, you can go ahead and put your shirt back on. Do you have, that does finish my head to thorax assessment. Do you have any questions for me? I know I did mark the reason for your visit here and the pain. Do you have any questions for me though?
No, ma'am.
All right. Thank you for letting me assist you today, and the doctor should be with you shortly, okay?
Mm-hmm.